Don't forget that for PRF, blood drawing has to be really fast, as we don't use anticoagulants. Once your tubes are filled, put them immediately in the centrifuge machine and launch the cycle. This is why we advise to have the machine next to the room you're doing the phlebotomy. Once the spinning cycle has ended, withdraw the clot from the tubes within the 5 minutes. The more you wait, the more the fibrinogen will be consumed and you will have smaller clots. Once everything is prepared, both your sticky bone and your PRF membranes inside the PRF box, everything can be kept at local temperature for about 4 hours. For the anatomy, the preferential site is the elbow crease. In this area, we have two major veins. The first one is the basilic vein, facing the internal part of the body. Then we have the cephalic vein on the external part. If we focus on this vein, they're drawing an M, and this is what we call the M design. You can have 1 up to 4 branches of the M. About the equipment, you need to have everything prepared before beginning. The tourniquet, alcohol, an adhesive bandage, the vein lighting option, the blood collector, and your PRF tubes. Once you're starting PRF, everything has to be prepared. Open the tube package, which are stored in the refrigerator, and put them in the bug bag. The first step is to prepare the adhesive bandage and to stick it on the active end. Then place the tourniquet above the elbow and tie it strongly. Apply alcohol and tap on the skin to increase the local temperature and increase the diameters of the vein. Then palp with the index inside the venous M to find the best vein. Take a pen to place your vein guide. The points have to be placed exactly where you have the sensation of the vein. If you have the vein light, you can check the accuracy of your guide at this step. Then, pull the skin at 10 cm of the puncture point. By doing so, you're going to decrease the skin's thickness locally and facilitate the needle penetration. If you have rolling vein, this is also a way to immobilize them. Take your needle and introduce it in the skin with an angle of 15 to 30 degrees. Bevel always facing up. The movement has to be fast and precise. Check the blood backflow inside the tubing. If so, you can stick the bandage. Then connect your PRF tubes. Take the tubes from the pump pack and put them in the tube holder. Maintain strongly the tube inside the holder. Once the tube is filled, put it back in the pump pack and start filling another one. Remember that for PRF, the tourniquet has to stay during the whole procedure. Remove the tourniquet and remove the needle. Press on the puncture point after needle withdrawal. Ask the patient to fold the arm for hemostasis. Don't forget to immediately withdraw the needle to avoid any accident. In the tricky situation, we have the case of curvy or short vein. In those cases, just penetrate the skin a little bit before so you have the bevel in the tangible part of the vein. Sometimes the bevel can also be in contact with the venous wall and stop the tube filling. In those cases, just pull the skin in the axis of the vein to separate the bevel from the venous wall. Now it's your turn.